I've already washed my hands, and I covered this over the bed table with disposable pad because it can get messy over here. And I want to prepare my equipment. I'm going to open up my saline flush. And this extension tubing is not in the original packaging. But what I'm going to do is I'm going to go ahead and prime it. Get that pressure relieved. And I'm going to, this is all sterile, but I was able to remove it without contaminating. So you will push and turn. Go ahead and take this out. And I'm going to prime that to the end. Okay, alrighty. And then what I like to do, of course this bag really doesn't lend itself for that, but we're going to, I'm just going to stick the end in here. I will take the sterile cap off, and I'm going to just stick it right in there so it will be ready to go. Now this is an injection port. You might call it a clave, a buffalo cap, a PRN adapter. That was the very first thing that I learned, is they were called PRN adapters. But sometimes seems like lately I've been calling them injection ports. But it's the same kind of lure lock, and just exactly what I did on the extension tubing. You just put your syringe into here, and it's not going to take but just a smidgen to get this primed. And you can pull this off, and you can just kind of leave that right there. And again, you could take your top off, and your syringe is attached to it, but that makes it ready to go when you get your IV catheter in. Should have got me a little trash bag. Okay, so I've got that primed, and I'm gonna go ahead and open up an IV catheter. And this is a Protect IV catheter. It's a 20 gauge. Okay, let's see, put my paper down. And I like to go ahead and just take the top off. Cause see how that was kind of not wanting to come off? And I just like to make sure that it's not glued together, it hasn't been a manufacturer defect, and that the top will come off. But I'm gonna lay this right back in here. That needle and catheter is protected, and I want to keep that sterile. Okay, I'm going to do the tourniquet. And I see exactly where I'm going to start a vein. Okay, alrighty, going to release that for a little bit. Now you can look for a vein first, and then release it, and then prepare your equipment. You know, the steps are not set in stone. So whatever, works out for you, whatever routine works out for you, that's good. Okay, I do want to remember to put a disposable pad, even though has this on here as a protection. I always want to put something under the patient's arm, so I want to demonstrate that. The patient's arm may be in the bed, or it might be on a table. Just you can see that I'm sitting down, and I prefer to sit down when I do IVs and just kind of be eyeball to eyeball with the patient. Okay, now then I'm going to put my tourniquet back on, because I believe I have everything ready to go. And then I'm going to put my gloves on and clean. Okay, so that's vein is filling up with blood. Okay, this is the preferred method of cleaning the, it's the chlorhexidine gluconate. This is a chloroprep, it says, but I'm not going to use this. I don't have very many of these, so I'm going to just lay that aside, and I'm going to choose to use the alcohol. Okay, so I have got my IV catheter. And this particular type, it has a little tab up at the top because you want to make sure that your bevel is up. You want to pull back on the skin with your thumb. And these veins do not roll. So I'm just going to pull the skin back with my thumb. So you want to go at a 15 to 30 degree angle. Okay, I should have gotten some flashback. Let's see if I've got the right thing open. There we go. Okay. Then I will, once you see the flashback, you see I have a little drop of blood right here. And I'm going to go in about an eighth to a fourth more. All right, see? Good. And then I will push that off. Now, before I take this needle out, I'm going to pop the tourniquet, and about an inch or inch and a half above here, I'm going to put pressure. Now, these mannequins have very hard skin, hard vessels and everything, so it may continue to bleed when I disconnect it here. But I want to take it off, and this is, I will try to press down as much as I can, but you can see it, I'm trying to activate the safety, and I will grab my little thing here and do it up. Okay, now you can see what a mess. And if you got a patient that's got a lot of pressure, you might find that you will make a mess too, but that's the reason we want to have a pad underneath. And sometimes when I always wear white uniforms, and I will put a towel or a pad in my lap as well. Alrighty, now then we're ready to flush. I'm not going to aspirate because I can tell, but I guess I could. Oh, see, if you aspirate, but I knew for sure that I was in that vein. Alrighty, so I'm going to watch for swelling. So I am going to, I do not see any swelling. Okay, alrighty. Now then, I am going to just clamp that off, and we need to do some cleanup before okay, look, blood backed up. I'm gonna cut this little blood supply off here. If I can get it with one hand. There we go. When you got the blood backing up into the tubing, you know for sure you're in the vein. Okay, now then, I'm stabilizing that catheter and opening this up. And I want to clean this blood up. Okay, and all right, I think I'm going to need another one. I still see some blood. Okay, and we'll let that dry. We want that to dry naturally and not fan it. So we don't want to fan any unnecessary bacteria or viruses over the site. So they'll just take just a little bit to dry. And I realized that I did not, yes, I did. Look here on the end of my table, I have my tape ready to go. So if you will, when you're preparing your supplies, go ahead and do your tape. Take one piece and split it in two. Oh, it's not dangling. Okay, should be dangling. I did this earlier in the week. Okay. Okay, so that's what it'll look like. You'll have your split piece, and then you have a little longer, two longer pieces there. Okay, I'm going to take a little piece of gauze just to speed our process here and dry this alcohol because it's not drying on this fake skin like it would on a person's skin. Okay, now then let's take, I'm going to show you how to do this, but this is, usually it's difficult for students to do. And we have not been teaching this making chevrons for several years now. But I'm going to go ahead and show you how to do it and see how tape just sticks so bad. But you want to turn it so the sticky side is up. Okay, you lift up under there. Okay, and you crisscross. Okay, being very careful that you do not cover the site of where the catheter is flush with the skin there. And then because you have an extra piece left, you can just put this across this way. Now, if you were not using the chevron, and it's perfectly fine by me because this is what we have been teaching for years, instead of putting that chevron, you can just take your little narrow piece of tape and lay it here. And then that would be the only piece. But for your checkoff, if you want to do one or both, or you can just add your op site like that and not have any tape underneath it. And I think when the op sites came into use for IVs, I don't believe it was intended for tape to ever be up under an op site. But it just depends on hospital facility, their guidelines, their protocols, so you always want to do the things that they have set down as to how they want you to do it, and they may not care one way or the other. But, you know, always follow your facility's guidelines. Okay, now then, that is, I would go ahead and take that off and just want to loop this around. And let's see, oh, right here on this little dressing was a label. So you would put your date, the time, your initials, and this was a number 20. And you would put that on here. And you can see he's already tattooed. I am not going to put this back on here because you can see right here, this is where a label had been, and it's on the transparent. That's why I guess it's a semi-permeable, because this ink went through this paper, through this plastic, onto the mannequin, and that cannot be removed. So I'm not going to put this label on. But that's what you would write on the label, and you always want to put a label on your dressing. Okay, so I'll take another piece of tape. I'm going to loop this around. even put another piece right here. You just don't want to put any tape at this junction where the IV catheter and the end that you screw in, I don't even know what that's called. So, because that way if you needed to change just this extension tubing or something, you could disconnect without taking the IV out. All right, now then, we've finished that part, and I want to demonstrate how to give an IV push med. Now then, I've got some IV push medicine. And remember, when you're giving your medications, you got to go through all the rights, and there's 6 rights, there's 5 that you need to look at, and then that 6th one is documentation. But you want to make sure you got the right medicine, the right time, the right dosage, right pay, all that. You know those rights. Okay, now then, I may have used up, now here it is. Here's my alcohol, okay. So when I have an IV push and the patient just has this saline lock. So what I want to do first, get the air out of my flush. See how it's shot up? Want to clean, let me lay my medicine down. Clean this port all around it. And then I'm going to flush to make sure that it's a good site. Don't forget to unclamp it. Okay, so you will flush, observe the site. Change my hand. Okay, went in very well. So then now I want to, I'm gonna clamp it because I know that blood may just shoot right back. Okay, take this off, and we will take alcohol and we will rub it again. Take our medicine, and we have learned that I didn't have a particular medicine, but whatever your drug book has said for you to infuse it, you know, at a certain rate, push that in and screw it, and you're going to look at the time, and you're going to divide it by 4, and so every 15 seconds I'll give 1/4 of the medicine, but you got to unclamp it. Okay, so I'm giving this very slowly. Sometimes you give them over 5 minutes, but most of the time it's over 1 to 2 minutes. Okay, I'm going to clamp that back because I know from experience that in this particular setup that blood may come right back. So then I will take some alcohol and rub that, take another flush, and this time let's get the air out. We want to give this final flush at the same rate. So I'll give about 1/4 of it every 15 seconds. But it will go in if you unclamp it. Okay, so there we go. Okay, so do it at the same rate. And these little flushes that I've used were just a 3 ml flush. I like to use a 10 ml when I initiate, and then I don't have to be anxious if I'm going to have enough fluid or not. Okay, I will clamp it, take that off. Alrighty, now then, let me demonstrate how to do an IV medication. Now, I showed you earlier how to set up your piggyback. Of course, now this would be, I left the hanger back over there by the sink, but this would be, I'm sorry, I got the wrong one. Your primary one would be hanging lower, okay? So this is a demonstration of giving the IV piggyback. So I've got it all connected like I demonstrated earlier. Then you would bring it to your patient. Clean your port, 15 seconds, across the top, around those little ridges there. Okay. Then you would remove your protective cap, push in, and roll it into place. Okay. Unclamp. Okay. Now you would need to flush before you did that. I have flushed so much I didn't even think much about it. But you will always want to make sure that the IV catheter is patent, that fluid will flow through it, that the catheter is in the vein. So flush and then attach it. All right, the infusion has stopped. This saline because you would always hang, not that large of a bag, usually a 500 ml bag is what you hang with a intermittent IV piggyback. So after the piggyback medicine has finished, then this larger bag will start infusing, and it will be giving you a nice flush. Okay, so now then, close the clamps down, and clamp it here, and take it off. Now, if you want to, you can give it another flush, but in the hospital, these are usually always on a pump, and you can program the pump for the rate for your IV piggyback, and then program the rate for your primary, which is, you know, if you've just got an intermittent, you will always hang normal saline with it, and then you could program how many mils you want to infuse, so it will give it a nice flush. Okay, so we have done that, and now I need to show you how to give a medication with a continuous IV infusion. I'll get my medication. And I see I had already had my flush here already, but when I got here this morning, I looked at my table and I didn't see my extra flush, and I went and got some more. So I was thinking, I didn't have everything ready, but I actually did. Oh, there's my other alcohol. So that is infusing. Okay, I want to take one of these little flushes. Okay, you're going to find the port that is closest. Let me put the top back on this for now. You want to find the port that's as closest to the patient. So that would be this one. Take your alcohol, clean that port all around, on top, let it dry. Pull back, get your air out of your flush, insert it. Okay, now this is what you've got to do. You have got to pinch this off so that when you put this pressure on this little syringe, that the flush doesn't go this direction. You want it to go this way. And if you had medication that was not compatible to this fluid, this would help to put space between the fluid and the medicine. But that would also be a policy that, a facility policy as to if they would allow you to put flush space between the two incompatible medicines. All right, so I have my medicine. Wipe it again. Still pinching it off. You almost need 3 hands, don't you, to be a nurse? Okay. All right. Now then, I'm going to, again, you look at your watch because you will give it over the rate that's specified in your drug book. Divide it by 4. Keep pinching. Okay. Now this you can decide. If you want to unpinch while you're waiting for the next 15 seconds, you can, or you can just keep it pinched the whole time. It may be less risk to just keep it pinched, then you don't have to remember to pinch again. Just keep it pinched while you give it. You will not be checking off on given IV med through an infusion. It's on your evaluation form, but we will just make that non-applicable. We will not check you off on this. Okay, so the minute is up. My medication is in. Take that off. Take the alcohol and wipe it. And I'm keeping it pinched still just in case, let's see where my other, right in front of me, I didn't have it open. In case it was incompatible. That does not want to. These are not new. These have been used. I don't know if it's going to work or not. But anyway, let's put it in there and go ahead and push that through at the same rate that you were using. Okay, so that puts a buffer between the medication and this fluid. Okay. Alrighty, then release it. And we're done. Okay, so we'll just clean up the mess, put all the sharps in the sharp container. Okay, our patient does not need an IV any longer, so I'm going to demonstrate on how to take it out. I have already put my gloves on, and I have my supplies here, and I'm just going to use this disposable pad that's already on the table. The first thing I want to do is, of course, take the tape off, and we're going to try to be very gentle with that. And I tell you, with gloves on, it is not easy. Try to get all of this out. And this particular patient has very tough skin. I do not have to worry about fragile skin on Mr. Manny. He is as tough as it comes. But anyway, Mr. Manny, I am being as careful with this as I'm going to take all of this off. And I'm pulling it and push down the skin. As I pull, I want to support this catheter. There we go. Now you would not pull that as quickly as I still got some tape. Okay, so now then, let's take this other tape off. It's a little bit stuck over here on his skin. I'm just having to dig at it. Okay, Then let's get the rest of this chevron off here. If I can get that up. See, I've been a nurse so long, see, I didn't train with tape. I didn't train with gloves. So it is, takes a little something to get used to. They just seem so bulky and in the way. Okay, now all the tape is removed. Now at this point, you want to, I'm still stabilizing the catheter, and I want to clean. So let's clean around the site here where the catheter goes into the skin. Alrighty, now I already knew that Mr. Manny's skin does not dry very quickly, so I brought a little extra 4x4. I'm sorry, a 2x2. And I'm gonna, okay, now then I'll get me a 2x2 and I'll just lay it there. And then I'm going to be ready to apply pressure when this is pulled out. So I'm going to pull it out, put my pressure down, and then I will look at this catheter. The tip looks good, the length looks good, there's no burrs or cracks or jagged edges. It looks really good. So I'm going to lay this aside, and remember, I'm going to hold pressure for 30 seconds at least before you even peep to see if it has stopped bleeding. If Mr. Manny had been on anticoagulants, that means his blood would be not coagulating well, and you'd have to maybe put pressure for 5 to 10 minutes. So I think if I had to hold pressure for 5 to 10 minutes at this age with my arthritis, I think I'd have to use the call light to tag team and have somebody else to come hold pressure for a little while longer. But anyway, alrighty, so I'm gonna peep. Ooh, so you can already tell from that little bit of pressure. And I was really putting pressure on him, not forgetting that he wasn't real. Okay, he is not bleeding. Okay, I'm gonna still put the pressure while I grab another, oh, that's the one I had a while ago. Let's grab a clean one, a clean sterile one. I folded it in two, and I'm gonna replace that one with this. And I have my tape torn already, so I can grab it. See, that tape sticks to your gloves. And put that across there. Look at there. Sticking to the gloves. Okay, that's not very pretty. It'd be nice to have that completely symmetrical there. Or you may want to, you can add a Band-Aid if you like. Okay. And we'll tell your patient to monitor this, because if he's getting ready to go home, let him and his family member know to keep an eye on this, because sometimes even 1 to 2 days later, there may be some complications from that IV site. So you want to teach them to look for drainage and redness, swelling, pain, bleeding if it starts back bleeding. Okay, then I think we're done with working with Mr. Manny today. He has had his IV inserted, he's had his IV meds, and now he's had his IV removed. And that's the end.